Neighborhood Health Watch is sponsored by the doctors of HCA Virginia.
Today in Neighborhood Health Watch, acute low back pain, the #2 reason people call a doctor. It's second only to cold and flu, and almost everyone will have some back pain at some point in their life. This pain and discomfort can occur anywhere in your back, but it's most common in the lower back, and that's because the lower back supports most of your body weight. Now with some words of relief today is Dr. Crowl. And Dr. Crowl is with Henrico Doctors Hospital, the orthopedic hospital at the Parham campus. We were hoping to see some pictures of people suffering with back pain, but that didn't happen today. But tell us what some of the common causes are.
Most causes of acute back pain are generally self-limited, but usually related to strain injuries of either the disc or the small ligaments or muscle attachments from the bone out to the sides of the spine. Most of the time they'll resolve in the course of 1 to 2 weeks. Usually if people self-restrict some of the activity that hurts, utilize a brief period of bed rest, and utilize some over-the-counter anti-inflammatories, it'll start to resolve for them pretty quickly.
And the brief period of bed rest, that's important because contrary to common belief, if you rest too much, it's counterproductive.
Yes, ma'am,
right?
absolutely. That thinking has changed considerably over the last few decades. So now we recommend really only 24 to 36 hours of bed rest before, actually we call it active recovery, getting up and starting to move again.
Is that pain dangerous?
It can be. Most of the time it is not, and especially when the pain is limited to either the center of your back or just off to the side. When pain starts to radiate way down into the legs towards your ankle and starts to make it weak, that can potentially start to be a more serious condition.
When should a person have an MRI or surgery?
As far as getting the MRI, in most acute issues of low back pain, usually MRI does not provide additional helpful information other than your physical exam. However, if people start having weakness down the leg, numbness and tingling in both legs, then MRI becomes important to determine whether or not there is significant neurologic compression.
And quickly, the best treatment options, exercise or?
Exercise. Prevention is the biggest one. Maintaining good body mechanics with lifting. Bend with your hips and your knees and not your back. Everybody talks about their core being strong, and that is actually really important.
Right.
And if we can maintain those, we can actually keep ourselves out of the hospital.
All right. Dr. Crowl, thank you so much for joining us on
Absolutely.
First at 4.